exercise can be a really great adjunct to any kind of treatments that somebody's using for addiction. You've seen this slide before, but I wanted to highlight again, one of the reasons that physical activity is so beneficial in treating addicts is because it improves self-regulation. And we see that in this particular study, the people that were put on the exercise program, they decreased smoking, alcohol, caffeine, they had reduced stress, and they reduced emotional distress, all of which can, especially the emotional things, can increase that desire for the substance. So we want to start exercising. And of course, it's changing the brain in specific areas that are leading to that improvement in self-regulation. You've seen this slide too, but I just wanted to reinforce that exercise is increasing that gray matter volume in the insula. Again, that insula is really important in setting and pursuing goals, creating purpose and meaning in life. So we want to do this because this is going to, obviously, somebody that's trying to change an addiction is trying to set and pursue new goals and needs to have that sense of purpose and meaning and personal growth. So this is important. Now, when we look at how much is needed in some of the studies, let's say, for example, blunting cravings, in a study in 2004 found that just 10 minutes of exercise helped to blunt cravings for alcohol. So it doesn't mean that everything's going to just be hunky-dory just because you start going for a jog, but it is helpful, and especially over time, the way it retrains the brain. But just 10 minutes of exercise helps to blunt those cravings. So if we start to break up exercise into chunks throughout the day, that may help to keep those cravings down a little bit more. And also, if we know there's certain times a day where our stress levels increase, this is the perfect time to start to set up for our clients or find out when their stress levels are and get them to do some small bouts of exercise during that time. And even just 5 minutes of intense exercise has been shown to reduce nicotine cravings. And exercise is shown to fend off those cravings for almost an hour. So this is wonderful because it helps to increase that time to the next cigarette. And specifically looking at some other treatments, the cognitive behavioral therapy, exercise has been proven effective in helping people quit smoking when it's combined with this therapeutic technique. So exercise helps to address the psychological and the physiological need that nicotine replacement alone cannot do. It hits both the bottom up of the brain and the top down. It's hitting the, it's working in a lot of different ways. It helps to, of course, reduce those negative feelings by improving chemicals and all the things we've talked about and reducing stress. And it also helps to reduce weight gain, which is one of the reasons that some people will go back to smoking because they use it as a form of keeping their weight down. There's some pretty interesting research looking at mindful type of exercise. In this particular study, this is a pilot study, so you really need more research, but this was looking at Qigong, and it was used early in recovery. But what the researchers found was that this type of exercise was able to effectively reduce cocaine cravings and related depression. I thought that was pretty cool. The other thing that we see is exercise actually increases these cannabinoids, these endocannabinoids. Endocannabinoids, you might think of cannabis, so they actually are targeting the same receptors. So exercise, chocolate, and marijuana are all activating these endocannabinoid receptors. Now, there's different types of endocannabinoid receptors, but and so you get some slightly different sensations based on which ones you're targeting. Now, marijuana affects both the cannabinoid receptor type 1 and 2, so it has more effects. So we can get those analgesic effects, we can get those hallucinogenic effects, whereas things like chocolate, of course, is going to have a much more mild effect compared to something like like the TCH in marijuana, but we can actually have some effect. There are even some essential oils like copaiba that can act on these endocannabinoids receptors as well. So the endocannabinoid system, basically it helps the body to manage anxiety, inflammation, and other physiological responses, to different forms of stress. And during exercise, particularly during strenuous exercise or stress, the body produces compounds called endocannabinoids. And one of them I mentioned was anandamide, or I didn't actually mention it. It was on the last slide. I forgot to mention it. And these endocannabinoids, they're basically signaling molecules, and they trigger the activation of this system, this endocannabinoid system, when and then they can be detected by these receptors. And the receptors are called cannabinoid receptors. And so these cannabinoid receptors not only detect the presence of the endocannabinoid, like the anandamide, which is increased when we exercise, or the THC from marijuana, but they can also affect molecules from outside sources that resemble endocannabinoids. So the term cannabinoid refers to basically any compound that's produced in the body or from the outside source that triggers the endocannabinoid system, and that's by activating the cannabinoid receptor. I'm hoping this is making sense. So that anandamide is an endocannabinoid compound that's actually produced in the body, and it activates two types of the cannabinoid receptors, that cannabinoid receptor 1 and the cannabinoid receptor 2. So when we have runner's high, this is a perfect example of that endocannabinoid system working. So after exercise, particularly longer duration or more strenuous exercise, the body is going to produce this anandamide. And then it binds with that, again, chemical receptor. It's going to bind with that cannabinoid receptor, and in turn, it turns on that endocannabinoid system. So we get this sense of pleasure, we get a sense of feeling calm. Now, the cannabinoid B receptor, or type 1, I should just say, the type 1 receptor, those are found mainly in the brain and in the central nervous system. And those are linked to the brain reward pathways, so we get that sense of pleasure from those. The cannabinoid B2 receptor, that's found in the rest of the body. So we see this in the muscles, in the skin, in vital organs. And so when we activate the type 2 receptors, then, or when the substance binds with the type 2 receptor, that's mainly, that's going to affect regulation of things like inflammation, for example. So exercising, again, it activates that endocannabinoid system. So it induces those mental changes, particularly that analgesia, sedentary or sedation, reduced anxiety, increased sense of well-being. And research shows that endurance exercise, again, increases that serum concentration and leads to some of these changes. And of course, the endocannabinoids are that class of neurotransmitters produced in the body and the brain during exercise, and they actually pass through that blood-brain barrier, unlike endorphins. This is just a study I wanted to highlight showing that exercise, now these people in the study were males, and they were engaging in moderate to higher levels of intensity. They were either on a treadmill or they cycled, and they did that for 50 minutes. And they found in that 50 minutes, they were able to double the concentration of the anandamide. So that's huge. And of course, that's going to lead to those pleasurable sensations and feelings. Now I'm going to switch gears to some mind-body stuff. This is really interesting. I used to, I never really thought that acupuncture would do anything, to be honest, for years. And then I remember watching, and this is many years ago, I remember watching a program, and it was a physician that worked with military, and all these military that were coming back with pain obviously with injuries, serious injuries, and on lots of opioids and other painkillers. And so they started using um, acupuncture to help with the pain management and how effective it was. So this whole program, it was really very well done. But that got me thinking. So I ended up getting onto the World Health Organization website, and I found they have a list of all of these different practices that there is significant amounts of research to support the benefits of this alternative therapy, this acupuncture. And so I've actually used it, not for pain management, but I had some other health issues, and I definitely saw some dramatic differences when I started using the acupuncture. And to be honest, I didn't think it would work. So it was pretty, even after reading the research, I still didn't think it was going to work, but it was pretty interesting. Anyway, some conditions, I've actually tried it for some other stuff, and I didn't find it to be as effective for that. But for some things, it was pretty interesting, I have to say. So there are other therapies in addition to acupuncture, which might help to increase relaxation and reduce cravings, and of course reduce pain. If we have pain, we're more likely to go towards substances and have increases in relapse. So this is a great technique, but just that diaphragmatic breathing, progressive muscle relaxation, mindfulness practices. Some research shows reductions in cravings and reduced relapse. We need more research here, but we want to try to use anything really that can help us to cope with stress. So meditation, if your client has some kind of a faith tradition, consider talking to them about that, and prayer. 12-step programs obviously have helped, countless numbers of people. Social connection, again, when we have addictions, oftentimes we're pushing away some, social connection or people that are really important, and we might be isolating and just with people that are accepting of this behavior that is unhealthy. And I mentioned there is some interesting research in essential oils. Not only are there some like the copaiba, which acts on that endocannabinoid system, but we also see there's quite a number of studies that have looked at essential oils like citrus oils like wild orange that have help to reduce stress. So people might use a diffuser, or they might just put the oils in their hands and breathe and inhale and smell. But it's pretty interesting. There's some pretty decent studies that have started looking at this. So that might be something, again, that you could just add in. We can add all of these things in and add them little by little so that we can not overwhelm our client, but bring them in. So progressive muscle relaxation, your book has a section on this, but I wanted to just talk about it if you're not familiar with this. Basically what you're doing is you are tightening an area and then relaxing it, and you basically are progressing through the body and doing this. And so one of the benefits is that when you tighten and you clench, you notice it. You want to pay attention to what that feels like in the body. What does that tightening feel like in the body? And we'll start to recognize, if we practice this regularly, we start to recognize that, when I'm under stress, guess what? I tighten up just like that. So it allows us to start to learn what that sensation feels like. So we recognize it very quickly, but also we've practiced and we've trained ourselves to learn how to not only recognize what the tension feels like, but how to let it go. So we learn how to let go and relax. So this is a great technique to help us to learn to recognize tension and stress and learn how to let go of it. So it's a great technique. There's materials, I've mentioned this Therapist Aid website a few times, and they have lots of, they have some audio stuff, they have interactive tools, they have all kinds of things, but they've got a practice, they've got scripts and all kinds. So this is a great resource to check out that can help you if you want to start using progressive muscle relaxation with your clients or for yourself. I wanted to mention this device that I came across. I have not used this, but I thought it was really interesting. It's Spire, and they have a device, they have an app, and they actually works on helping people to breathe, but it monitors all of it. So it's really, really pretty cool. Throughout the day, your breathing can be monitored, and you can get, the app will let people know, okay, you need to start, like, you need to breathe, you need to do this, and it has different types of breathing techniques. It's really interesting. And I've also got a couple studies here that you might find interesting as well. Here are some studies that if you're interested in. We've talked a lot about breathing based interventions, just that deep diaphragmatic breathing. There's lots of ways to go about breathing. Some will say to have the breath in for 6 seconds and out for 6 seconds. So you inhale 6 seconds and you exhale 6 seconds. Or kind of think of 6 breaths per minute. So you could have somebody time for a minute and just do 6 breaths per minute. Some of the benefits that the research has seen is when people are doing this very slow breathing, then they actually help to get better connection between the brain and the heart. We create more of this synchrony. We see improvements in that heart rate variability. And so that's one way you could do either the 6 seconds in, 6 seconds out, or about that 6 breaths per minute. There are other techniques where you breathe in and hold at the top of the breath for a couple seconds and then exhale slower. We used to use with cardiac patients, we would use pursed lip exhalation. So we would inhale through the nose and exhale like you're blowing through a small straw, really slowly. So this was a technique I didn't really even know at the time why or how it worked, but this was something that we used. I mean, it does help to strengthen the muscles, but it's also, I didn't know the other effects. I didn't realize how many other things it was doing in addition to training some muscles. But this is some more research where you can look into it if you want. We did it! We're done with another one. Good job, guys.